Welcome back. Racial and ethnic disparities in healthcare have been extensively documented among minority groups in terms of access, receipt, and quality of care. Structural racism affects multiple aspects of healthcare delivery, including the timing of palliative care access and minoritized people's trust in health systems and providers. For instance, African American and Hispanic patients often underutilize hospice services due to mistrust in the healthcare system, stemming from colonization, racism, and cultural differences in personal approaches to healthcare and medicine. One Accord Health is focused on preparing families for end of life and palliative care services. Joining us to tell us more is One Accord Health's president, James Farnum, and VP of Clinical Programs, Lolita Melhado. Hi, guys. Thanks for joining me.
Hi,
Uh,
good
great.
morning.
Good morning. So, to start off, can you just tell us a little bit more about what palliative care is?
Palliative care, the word palliative comes from the word palliate, and palliate means to alleviate the symptoms. So, palliative care is really care that focuses on symptoms that are unrelieved, such as shortness of breath, pain. Those are the most common symptoms that we see. Sometimes it's depression, anxiety, or the stress associated with that serious illness.
And so, when necessarily does a family need to start considering moving into palliative care?
Well, palliative care should be introduced at the time the person gets their serious illness. So, for example, if a person is diagnosed with cancer, that's the time that palliative care should be introduced because palliative care is not only going to help to alleviate some of the symptoms, but it's also going to provide that emotional or that spiritual support that the person may need.
Yeah, and I like that you just mentioned the emotional and spiritual support because with that, I wanted to ask, how does palliative care help the patient and the family?
By focusing on the patient and the family as one unit. Oftentimes you go to the doctor is just really focused on your disease. For example, if you have COPD, which is a chronic obstructive pulmonary disease, your provider may only be interested in that illness or in that chronic disease. Whereas with palliative care, we want to know how is the family dealing with this? How is the patient dealing with this illness? And then we try to provide that support, whether it's, like I said, social support, physical support, spiritual support.
I think that's so important because, as you just mentioned, that a doctor may focus on the medical diagnosis and that specific aspect in itself. But when you are presented with a life-threatening illness, it's more than just the illness itself, and there's a lot of other factors that help. A lot of people say, mental, your mental well-being, your spiritual well-being, that's half the battle. So I think to also help build that up is extremely important.
Yeah, it's a holistic approach,
Mm-hmm.
and that's why I love palliative care because we want to get to know the person, what their life was like, who is their family, and oftentimes there's a lot of underlying dysfunction going on, and we try to provide some means of coping with that illness.
Yeah, absolutely. And, when it comes to palliative care, when you start looking for services, does that necessarily mean that death is near?
No, actually, I think everyone is aware that our former president, Carter, is under hospice care. Hospice care focuses on end of life.
Hmm.
Another way to kind of look at this is that healthcare is divided into three buckets: sick care, well care, and end of life care. And so palliative care goes along with sick care. And oftentimes, if you have that serious illness, that's the time that you need the palliative care so that we can help alleviate those symptoms. So, no, it's not necessarily end of life.
Yeah, of course. And, James, I want to ask you, what are some components of palliative care?
Well, I think Lolita mentioned this. It's really about um, spiritual, uh, physical pain relief, and really the end of life resources that people need in order to make sure their affairs are in order.
Yeah, of course. And, a lot of families don't do advanced care planning, and unfortunately, families are left to make the decisions, which, a lot of times is difficult to make. So, how does One Accord help with that process?
That's a really good point. So when we talk to people, everyone agrees that advanced care planning is important. It's just not a priority. And frankly, we're here to educate the community to let them know that the most loving thing you can do is let your loved ones know what your personal wishes are at end of life. And advanced care planning allows us to document, store, and uh, communicate what your wishes are with the family. To be honest with you, we plan our careers, we plan our vacation, and even our retirement. But when it comes to end of life planning, mums is the word.
Yeah, absolutely. And, I want to talk a little bit about this new partnership with AdVault. How can this help people during this sensitive time, especially, with advanced care planning?
Yeah, thank you for that. We're really excited about this partnership with Advil. Um, our company really focuses on the goals of care conversation and palliative care. So we have expertise in that area. But one of the things that's really important is that when you do have a plan, that plan shows up when it matters most. Like, for example, if you're in the ER department. So we partnered with Advil, which is our digital platform a partner. And so now we have an end-to-end solution. So not only can we facilitate and help you put your plan together, through their technology, we're able to document, store, network, and then have it show up at the ER room because it's connected through interoperability with about 80 to 90% of the hospitals in the country. So when it matters most, they can pull down your plans and everyone will know what your wishes are.
Yeah, of course. And we've been discussing palliative care and just sometimes the sensitivity around that topic. So can you tell me sometimes that when families go to enlisted services, what is the reception usually like throughout the process?
Yeah, so if I'm seeing a person in the hospital because they're hearing the word palliative for the first time, often they're in the hospital because they're very sick, they have symptoms that have not been relieved, and they immediately think of end of life. And so there's a lot of education around palliative care. We try to provide that education around the disease process so that the person really understands what's happening to them and where they are and their stage of illness so that we can help them to plan for improving their quality of life. And that's essentially what palliative care does. It helps to improve the quality of life.
Yeah, absolutely. And with that, I want to thank both of you for speaking with me today. This was very informative.
Thank you.
Thank you.
Of course. For more information, you can visit the website at oneaccordhealth.com. Don't go anywhere. We'll be back with more open right after this.